director of the Prostate Cancer Research and Education Foundation. Every year in September, it is the Prostate Cancer Month, and we have the tradition of interviewing Dr. Mark Scholz from PCRI. They organize every year an international prostate cancer conference. And this year, like any other year, we are very fortunate to have Dr. Mark Scholz. So let's go now to Dr. Mark Scholz. Dr. Scholz, please tell us about the conference, what's unique, what topics will be discussed, and what speakers you would like to highlight for this meeting. Dr. Scholz?
Hi, Israel. Thanks so much for asking me to speak to your audience and people who are interested in prostate cancer. This year's Prostate Cancer Conference is going to be about patient empowerment and shared decision-making. It occurs this September on the 5th, 6th, and 7th. It's a unique conference because it's exclusively for patients, and patients are going to be able to interact closely with experts and other thought leaders, and of course with other patients, people that have been there and done that before. This year's program is going to stress new breakthroughs in imaging, immunology, hormone therapy, and cancer staging. The Saturday program is structured around the PCRI Shades of Blue way of dividing prostate cancer into 5 broad categories. So there's going to be expert presentations on active surveillance, state-of-the-art radiation, and new medications for advanced disease. We have a lot of world-class physicians coming in, like Dr. Maha Hussein from the University of Michigan, that's Dr. Moyad's alma mater, and Dr. Anthony Zeitman from Harvard Medical School. So it's going to be a great time, and we're really, really fortunate to have some wonderful doctors this year.
Hormonal blockade is always a very important topic that patients like to know about, and this year we wrote an interesting paper about the use of Xtandi, or the enzalutamide, as a primary treatment for prostate cancer. Could you shed a bit light on this approach?
Israel, thanks for asking. As you know, in my book, Invasion of the Prostate Snatchers, we talked about using hormone therapy instead of surgery or radiation as a primary treatment for prostate cancer. And the radiation has since improved, and we've been doing less hormone therapy now and more seed implants, more focal therapy, which has milder side effects. But there are new hormone medicines coming out now, one in particular called Xtandi, which is more potent than Lupron, and excuse me, more potent than Lupron, but wears off more quickly than Lupron. And it offers intriguing possibilities for revisiting hormone therapy as a primary treatment. So we published an article in a couple of gentlemen, results in a couple of gentlemen that had 6 months of Xtandi rather than Lupron, and they seem to have very nice results. Their cancers shrank up well. You, Israel, did a lot of early work with hormone stuff, and you know how effective it can be. The problem is the side effects. Well, the side effects were still there, but the good news was we were able to give it for a shorter period of time, and then the side effects wore off more quickly when we were finished. So we're in discussions with the company now about possibly a full-blown clinical trial for men with early-stage prostate cancer that would rather avoid surgery and radiation and might consider one of these new hormone treatments to treat their newly diagnosed prostate cancer.
Thank you, Dr. Scholz. There is no conference without discussing the issue of PSA and screening and biopsy. So what would you like to say this year on this topic?
Yes, Israel, isn't it a fascinating situation where we've got PSA blood testing that saves so many lives, but at the same time is unfortunately leading to so many men getting unnecessary radical treatment. The PSA is getting blamed for something that I lay at the door of the random biopsy, which is causing probably 100,000 men a year to get diagnosed with a low-grade form of prostate cancer. We call it grade 6, that never spreads. And this is frightening men and doctors, of course, into unnecessary treatment. So no one seems to realize that we can circumvent this problem with effective screening with multiparametric MRI imaging of the prostate or color Doppler ultrasound imaging of the prostate, and spare so many men the frightening specter of being diagnosed with a cancer. And yet no one seems to be hearing about this. So we continue to try and get the message out. We have our Vanguard group, which you can sign up for. We have regular emails and educational videos to talk about and raise awareness about how prostate imaging can be an effective substitute for a random 12-core needle biopsy.
Dr. Scholz, thank you very much for organizing this important conference and for all the good work you are doing for patients and educating the public on the important issue of how to relate to prostate cancer. Thank you, and thank you for listening. Goodbye.